So this morning, I'd like to welcome into the studio once again. Welcome back, Kelcey Noble, pharmacist over at Vassar. Hello.
Good morning. Thank you for having me.
Well, thanks for being here because I'm very confused and nervous about this Zika virus. That is all I've been hearing about is the Zika virus. It seems like it's a very dangerous thing. I want you to kind of let us know how afraid I should be about this. First of all, explain what is this virus I've been hearing about?
Sure. So the Zika virus is spread from mosquitoes, so it's a mosquito-borne illness. A mosquito will bite an infected person, and then they go on to the next person, and then they will infect that uninfected person with the virus. So we have pretty good mosquito control here in the United States, so our level of threat is pretty minimal at this time.
All right. So now I know this is big in like South America.
Definitely.
It's kind of taken off there. But there's a case, I guess there was just recently a case in Orange County of someone that was found. I guess they traveled and they came back and they have the Zika virus. So what would stop a mosquito from biting that person and then biting someone else and then start spreading it here in the Hudson Valley?
Right. So that's something that we have to be concerned about, especially in the springtime. So basically right now in the United States, there has been no local transmissions of the virus, meaning that only people who have traveled outside of the United States have brought the virus back. So if you are diagnosed with the virus, you should be very careful and protect yourself from getting bit by a mosquito so that you can prevent the spread to other people.
All right. Now, let's just back up a second. What does this virus do? So I've heard like there's a lot of complications if women are pregnant.
Mm-hmm. So the virus is self-limited. It lasts about 5 to 7 days. Your symptoms would be like rash, fever, muscle pain, some conjunctivitis, but in general, after 5 days, it goes away. There's no treatment currently and there's no vaccination. So it's just supportive care. So make sure you get a lot of rest and drink a lot of fluids, and you could take Tylenol for your muscle aches if you needed to.
So it's not a big deal unless you're pregnant. Now, if you're pregnant, there's a lot of complications with this, right?
So this virus has been associated with microcephaly, and that means babies being born with extremely small heads and small brains, which could potentially lead to brain damage. So in Brazil, they have noticed an increase in cases of babies with microcephaly, and but currently it's not known how many of those babies were actually exposed to the Zika virus. But
that's kind of terrifying, right? Like I know when my wife was pregnant, like we freaked out about everything. Like we would, triple wash the salad so we wouldn't get any kind of bacteria, and you couldn't eat any sushi. If there's this mosquitoes going around with this, I would be terrified.
Right. So it is a probable risk. At this time, the CDC recommends that any woman in the United States not travel to any countries that have known Zika virus and until after their pregnancy, and just try and protect yourself from getting bit by a mosquito if you do go to those countries.
All right. So this is a virus, and most viruses you can get some sort of inoculation for. Are they working on some sort of vaccine for this virus? Is there a vaccine?
At this time, there's no vaccine to prevent you from getting the Zika virus. So basically, in order to protect yourself, wear long clothing if you're traveling to these countries, bug spray, and reapply as instructed.
But you would say if you're pregnant, don't do it. Don't travel to these countries.
No, it's definitely not recommended by the
CDC. That's kind of scary. Like your biggest protection right now is deep woods off for this thing. That's kind of scary.